So people with neurologic diseases, as I'm sure the audience knows, have a complex set of issues that they need to deal with. They deal with a number of different providers and they get a number of different treatment plans. It can be very confusing for patients to know, how do these fit together? How do they interact? What do I do next? So what we've really done with our comprehensive center is developed a building where all of the resources the patient needs to have and know about are co-located, then created a navigated experience so that they almost have like a personal trainer type of experience. So when you go to your personal trainer and you say, hey, I want to be able to run a mile and lose 30 pounds or 20 pounds, you don't tell them exactly how to do it. They don't tell you step by step what to do. You develop a plan and they help coach you through that plan. That's what we're developing in our center, is developing that integrated comprehensive experience that allows people to live the best life they can with their chronic neurologic condition without having to worry about, are they missing anything or is everything working together perfectly? So are they getting the right doses of medicines? Are they in the right support groups? Do they have questions about what's the newest and latest thing they can do for their disease? All of those kind of things become simple. So we really thought that was a missing ingredient in a lot of patients' care with chronic neurologic problems, and we put a lot of resources to develop a best-in-class program for that. For different diseases, it'd be a different scenario. So say, for example, a patient who had a neurologic injury and had chronic pain, and there's a treatment algorithm we'd follow that may end up with implanting a device to control that pain. Say it's a movement disorder patient who has Parkinson's disease, and they have the medications, they have physical therapy type of recommendations and speech therapy recommendations, and then it may come to where they need an implanted device to help control the symptoms as well. That's what a lot of people do, and in our system, what we would then do is also integrate all that so the patient really has someone aligning all those treatments, aligning all of the options, and more around nutrition and other things to really provide, as you said, all of the information they need to lead a worry-free life with the disease they have to maximize their health and healthfulness. I think, again, the approach we have in the entire Neuroscience Institute is start with the person and their disease, and then figure out from there, how do we bring together all the resources that are best for them without them having to hunt and peck for the options. So for chronic pain, how do we maximize the behavioral health component of chronic pain and the medical management, and then the technology, the implants and things like that? I think, people get wowed by the technology, and I'll talk about that in a minute. But I think you need to start out with the basics. How do people get through their day to day? How do we do simplest to most complex, and how do we follow that path with them and help them follow that? That being said, there's just some super cool technology coming out, because with microdization of computers, we can put smaller and smaller devices and implant them. And then there's some technologies, some AI, some not AI, that becomes learning technology. So it's not just a dormant device that provides maybe some electrical stimulation to control pain. It becomes a learning device that evolves with the patient to almost adapt to them as things change. And that technology is just really starting to blossom. So I think particularly in the neurosciences, microdization of computers, AI assist on a lot of things is going to allow us to treat pain symptoms better, treat strokes better, and perhaps even bypass stroke areas of the brain and reconnect other parts. So there's super cool things in the neurosciences with technology that's just going to continue to grow. But I just want to caution, we don't want to forget the patient and leave the patient behind. We got to bring it all together so they understand it and we address their needs, but also kind of get them the best that's out there.